Hi, can you start us off with who you are and what you do?
I'm Dr. Hayden. I'm a general dentist in the Cincinnati area. I have a practice in Montgomery as well as a mobile dental unit that I run as well in the city.
How does mobile dental work?
I go to a lot of the underserved areas where there's nursing homes, schools, special needs homes, homeless shelters. That's the type of community that I would focus. I focus on with the mobile.
What drew you towards dentistry?
so it's a combination of things. I've always been into the healthcare field, and I actually thought I wanted to be a surgeon, and went to look at a surgery, and it was not as exciting and bloody as I thought it should be. And so I went to shadow my dentist, and she was doing extractions, and blood was just shooting out everywhere, and it was great.
So the blood is what drew you to it.
Yeah.
Is it something you see often, like on a daily basis?
So with general dentistry, you have a variety of everything. So from patient to patient, it's something new. And you never know who's coming in the door with what else needs to be done that's not on the schedule. So yeah, you're getting a variety versus a specialty where I'm just focusing on one area. General dentistry allows me to do a broad spectrum of things.
Okay. What is a typical day like for you?
Typical day is I try to get to the office. Well, I wake up and I do a devotion, and then I get to the office around 8 o'clock, 8:15. Try to get the music going, the atmosphere in a relaxing place. We burn candles in the office, like eucalyptus. It's all a vibe. So I've got relaxing music, the candles going, and then 8:30, my staff starts to walk through the doors, and then they're starting to get the patient trays together and everything for the patient. And then around 9 o'clock, we see our first patient, um, and that goes on till about 5, and we're just boom, 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 back to back, depending on what it is. So sometimes your assistant can come up and be like, "So, it's not a new patient like we thought. She needs a tooth taken out." You're like, "Okay, we'll set up a tray." And so the variety of it is amazing because it just allows you not to feel stagnant in your career, from day to day. And then the end of the day at 5 o'clock, we go home and we start over.
What's some of the challenges that you face in dentistry?
So, how do you say this politically correct? I'm a very conservative dentist, and there are dentists that are aggressive in their treatment, and I tend to be a little bit conservative. So when a patient comes in with a treatment plan already from a previous dentist, and I don't agree with the treatment plan because I'm more conservative of approach, it can come off a little bit of a conflict between the two of which treatment plan they want to go with. And then the other issue would be running a staff. No one tells you in dental school the business side of it. You get all the clinical side, and then you get out in the world and you're like, okay, now run a practice. Here's your own business. And so now you're managing personalities. You're a psychiatrist at one moment, then you're a dentist, then you're a businesswoman, and you're like, I've got 1,000 hats on throughout the day. And you come home and you just want to be like, peace and quiet.
And how was being a Black woman in dentistry? How has that affected your experiences?
So I grew up in Cincinnati, went to Indian Hill, which was predominantly white. Then I went to Howard for undergrad, which is predominantly Black. And then I went to Howard for dental school, which is predominantly Black. And I came back to Cincinnati after I graduated from dental school, and I started to notice a lot of my people didn't have people who looked like them as doctors and dentists. And so I left again, and then I went back out to DC, and DC is predominantly Black. So it was a lot more Black physicians and dentists in that area. And I knew I had to get back to Cincinnati so I could help little brown kids and Black kids see people who look like them and say, hey, I can grow up to be that one day too. So most of the things I do, my whole coming back was for the mentorship.
So would you say that why diversifying the healthcare workforce, why that's
I'm,
important to you is to get more black doctors and dentists, etc.
can you repeat that? I'm sorry, the first part was a little broken up.
So would you say that the reason why diversifying the healthcare field to you would be to get more, black and brown, etc. faces into the healthcare workforce?
Yes, for sure. I think it's important for people to see people who look like them. I think it puts a barrier down for trust when you have someone that looks more like you. You're more willing to share your experiences or what's actually going on with you, versus coming in with a kind of side eyeing the person because you don't know what the history behind the medical field with the Black community and physicians is kind of already shaky. So when you have somebody that looks like you, that barrier is automatically removed.
You had one piece of advice to give to any pre-dent undergrad students, what would it be?
Learn how to find balance. Balance is really important to learn how to remove stress healthy, because life is always going to be stressful. Dentistry is a great field. When you get to school, look at it from a big picture, not details, and then hone in on the details. What else did I have to go through? Enjoy your experience. Dentistry, I was in pharmaceutical sales before this. So dentistry just allows me to have a career that I can choose my hours and choose my future if I wanted to start a family.
Dr. Sosa,
It's a super fun career though.
okay. Dr. Sosa, do you have anything to add or ask?
Yeah, thank you so much for that, Dr. Hayden. It made a lot of sense to me when you were talking about this idea of sort of the theme of this healthcare workforce diversity symposium is if you can see it, you can be it. So that's why we've been so focused on representation in this event. But one of the things, there were two things that you said that I want to follow up on. One was you were talking about the business side, and no one really teaches you about that. And I know now a lot of dentists are also pursuing an MBA along the way, or maybe there's a dual degree program where you can get both. How did you end up learning that for yourself to run your practice, since it's so critical?
So I spent a lot of time working under older dentists, a lot in particular that were not coming in the office. So it allowed me to see the front office and the way it ran, and the back office, the clinical side of things. As well as I sat right at the front desk. A lot of dentists don't sit at the front desk while the person's checking them out. I sat at the front desk and I wanted to learn.
Yeah.
Because I felt like there's no other way to learn if I'm not, I mean, you have a successful practice, why not take advantage of the opportunity of learning it straight firsthand?
Yeah. Okay, great. And then you also talked about your mobile dentistry. And I wondered if, I know part of going into healthcare is sort of this, it's a service profession, giving back, being a philanthropist, giving of your time when you're already working so hard and so much. So is your mobile dentistry, is that something that you do just to give back? And sort of how did that come to be?
So that's actually my passion.
Mhm.
I actually moved back to Cincinnati with the vision of the mobile dentistry only, and I ended up with a stationary practice in the process. But I had a dream, and the dream was you're going to be a traveling dentist, and you're going to go to the people, and so that's how everything's come to fruition. And the mobile dentist just has permitted me to go outside the scope of dentistry. It allows me to see people from all walks of life and allow them to have the same equal quality dental care that everyone else gets.
I love that. I mean, talk about breaking down barriers in terms of access to healthcare as a human right. It's amazing that you're doing that work. And it sounds like you're doing it just out of your own accord and your own passion.
Yeah, we do it like we're like 1 day a week, 2 days a week right now. 3 days in the office, 2 days on the mobile. So it's pretty incorporated in our schedule from week to week.
That's great. Thank you so much for giving back in that way, because you're really making a difference there. So that's all I have. Is there anything else that you'd like to share with us about your journey?
I would just say follow your heart, because if you follow the heart, the money will follow. A lot of people follow the money, and the money is harder to get when your heart's not in it. So follow your heart and the money will follow.
I love it. Great. Thank you so much. I'm going to stop the recording now.
No problem.